Assalamu alaikum. Welcome to my YouTube channel. My name is Danish Ali and this video about history taking. Session structure, introduction and describing aim objective, chief complaint, history of present illness, past medical history, systematic inquiry, family history, drug history, social history. Importance of history taking. Obtaining an accurate history is the critical first step in determining the etiology of a patient's problem. A large percentage of the time, 70%, you will actually be able to make a diagnosis based on the history alone. How to take a history. The sense of what constitutes important data will grow exponentially in future as you learn about the pathophysiology of disease. You are already in possession of the tools and that will enable you to obtain a good history. An ability to listen, ask common sense questions that help define the nature of a particular problem. A vast, sophisticated fund of knowledge not needed to successfully interview a patient. General approach. Introduction yourself. Note: never forget patient names. Create patient appropriately in a friendly, relaxed way, confidentially, and respect patient privacy. Try to see things from patient point of view. Understand patient underneath mental status, anxiety, irritation, or depression. Always exhibit neutral position. Listening, questioning, simple, clear, avoid medical terms, open, leading, interrupting, direct questions, and summarizing. Taking the history and recording. Always record personal details, names, umder, name, age, address, sex, ethnicity, occupation, religion, marital status, date of examination. Complete history taking. Chief complaint, history of present illness, past medical, surgical history, systematic review, family history, drug, blood, transfusion history, social history, gene of history. Chief complaint. Chief complaint. The main reason push the PT to seek for visiting a physician or for help. Usually a single symptoms, usually more than one complaints, for example chest pain, palpitation, shortness of breath, ankle swelling, etc. The patient describe the problem in their own words. It should be recorded in PT's own words. What brings you here? How can I help you? What seems to be the problem? Chief complaint. Short, specific, in one clear sentence, communicating present major problem issue. As timing, favor for last 2 weeks or since Monday. Recurrent, recurring episode of abdominal pain, cough, any major disease important, for example DM, asthma, ST, pregnancy, IHT. Note: CC should be put in patient language. Duration tips. Exact duration for how long you are ill, when you were completely normal, is this complaint for the first time or you have other episodes. History of present illness. Details, progression, regression of the CC. History of present illness and tips. Elaborate on the chief complaint in detail. Ask relevant associated symptoms. Have differential diagnosis in mind. Lead the conversion and thoughts. Decide weight the importance of minor complaints. History of presenting complaint HPC. In details of present problem with time of onset, mode of evaluation, any investigation, treatment, outcome, any associated positive or negative symptoms. Sequential presentation always relies story in days before admission. For example, a week before the admission, the patient fell while gardening, cut his foot with a stone. Narrate in details. By that evening, the foot became swollen and patient was unable to walk. Next day, patient attended hospital and they gave him some oral antibiotics. He does not know the name. There is no effect on his condition, and 2 days prior to admission, the foot continued to swell and started to discharge pus. There is high fever and rigors with nausea and vomiting. In details of symptomatic presentation. If patient has more than one symptom like chest pain, swollen legs and vomiting, take each symptom individually and follow it through fully, mentioning significant negatives as well, e.g. the pain was central crushing pain radiating to left jaw while gnawing the lawn. It lasted for less than 5 minutes and was relieved taking rest. No associated symptoms with pain, never had this pain before, no relation with food. He is non smoker, diabetic, father died of heart attack at age of 45. History of present illness and tips. Avoid medical terminology and make use of a descriptive language that is familiar to them. Ask OPQ or STA for each symptom. Pain, OPQ or ST, onset of disease, P for position site, Q for quality, nature, character, burning shop, stabbing, crushing, and other modes. R for relationship to anything or other bodily function, position, or for radiation where moved to relieving or aggravative factors, any activity or position. As for how it affects daily work, physical activities. T for timing, mood of onset, abrupt or gradual, or are these any associated symptoms. I hope you would like this video. Thanks for watching this video. Allah Hafiz.